Hello everyone, welcome again to my channel. Today we'll be talking about the access cavity for the maxillary first molar. But before we continue, make sure to smash the subscribe button down below because it would really help me to do more and more videos. The maxillary first molar is having a triangular access cavity with the 3 canals and 3 roots. As you can see, triangular shaped access cavity having 3 canals. The 3 canals are, one is mesiobuccal, one is distobuccal, and one is a palatal canal. And the placement of or the location of these canals is from its name. One is mesiobuccal, so you go mesiobuccally, and one is distobuccal, so you go distobuccally in order to find this canal, and etc. In some cases, we might have an additional canal called an MB2, and this canal, it is sometimes goes unnoticeable and it can lead to failure in RCT. Now, the average length for the MB, the distobuccal, and the palatal canal, this is the average. But of course, it is only estimation, but it's not exact. It will be the same for all patients. The mesiobuccal is the second largest canal, which is having 20 millimeters. The smallest goes for the distobuccal, that is 19.5 millimeters. The palatal is very wide, having a 20.5 millimeter working length. So as you can see, this patient is having 4 canals. 2 MB, which is MB1 and MB2, which are joined together, as you can see, and one is distobuccal, and one is palatal. As you can see, the widest canal there is the palatal canal. That is another picture showing you the MB1 and MB2. They are joined together. The MB2 is very narrow. It is very narrow that when you do the instrumentation for it, you need to be careful so that you will not cause any perforation. Now, what is the danger zone in the maxillary first molar? The dentine thickness in the distal concavity of the mesiobuccal root of the maxillary molar that is close to the furcation is the danger zone. Why is that? Because it can lead to perforation. So at the MB, which is at the mesiobuccal root of the maxillary molar, the dentine thickness, it is very thin, and it is close to the furcation. So you need to be careful while doing instrumentation there so that you will not cause any perforation there. Now, which canal it is difficult to locate? Obviously, the MB2, and failure might happen occasionally. Why? Because it goes unnoticeable. So you need to be a good endodontist in order to know if there is an MB2 or if there isn't. Now, always with the MB2 canal, because it is very narrow, so you need to instrument only with the small wave 1 gold.